I wanted to sort of bring people up to date on something that I think is very important in the world of MS. And this is based upon a consensus paper that came out in December of 2023 from the Consortium of Multiple Sclerosis Centers, or the CMSC. What they did is put together a panel of experts and looked at serum neurofilament light chain. Serum neurofilament light chain is an example of a biomarker. Biomarkers are tests that we use to sort of get a sense of what a certain healthcare problem is doing. So biomarkers are something that kind of gives us additional insight outside of what we would find, say, on talking to the person or doing a physical examination. You could argue in the world of MS that spinal fluid examination, MRIs, optical coherence tomography might be examples of biomarkers. So what is serum neurofilament light chain? Neurofilaments are sort of like, if you will, the frame of a house. So if you think of the neurons, one of the most important cells in the central nervous system, those neurons have a frame that sort of helps them stay together, just like your house would. And so a lot of that framing, if you will, or support for a neuron is neurofilaments. And one that is focused on in multiple sclerosis is this neurofilament light chain. Imagine if a tornado came along and knocked down a house. You're going to see pieces of that wooden frame go scattering everywhere. Well, things like multiple sclerosis can damage the neurons in your brain and spinal cord, and this neurofilament frame scatters just like that, sort of analogy of a house in a tornado. We can measure neurofilament light chain in spinal fluid, we can measure it in serum, and we can measure it in plasma. The highest concentrations that we see of the neurofilament light chain are actually in the spinal fluid, but we don't want to have to do spinal taps and put people through that on a regular basis to measure that. So the more reasonable way of measuring it would actually be with a blood test to look at the serum neurofilament light chain. It's important to note that this neurofilament light chain being released into the spinal fluid or into the blood is not specific to multiple sclerosis. Other things that damage neurons could cause this neurofilament light chain to be released into the spinal fluid or blood. It's also important to note that as we age, normal human aging is associated with higher levels of neurofilament light chain in the spinal fluid or blood. So where might we use blood tests for neurofilament light chain in the world of multiple sclerosis? Perhaps in the diagnosis of multiple sclerosis, in the sort of determining what sort of prognosis someone might have, both in the short term and in the long term, and in helping monitor therapy, and maybe even helping decide when we might stop therapies or de-escalate therapies. We mentioned that, as it relates to the diagnosis of MS, that these serum neurofilament light chains are not unique to MS. So while it does tell you that something is damaging neurons, it doesn't necessarily say that it's multiple sclerosis. So I don't see this particular biomarker taking the place of MRI or standard spinal fluid evaluations, the history and the physical that we use to make the diagnosis of MS. But in certain situations where maybe the diagnosis is not clear or there are MRI findings that are somewhat ambiguous, I could see maybe the blood test being used in those unique situations. In terms of helping make sort of a prognosis of someone's MS, the higher levels of neurofilament light chain would be associated with more active inflammation, more damage of neurons, and you could argue that might be a more concerning prognostic factor. I think the more helpful thing is we follow that neurofilament light chain over time. If I put someone on therapy and their neurofilament light chain doesn't go down, that might be more concerning, saying that they really have a very active and somewhat resistant inflammatory process going on. We think that we might be able to use this particular biomarker to help monitor how effective someone's therapy is. Again, if I put someone on treatment and this particular biomarker doesn't come down into a normal range or a more normal range, then that could be concerning. We think that we might be able to use this blood test to monitor people who don't have any relapses or have new lesions on MRI. So could this be a measure measure of sort of subtle low-level inflammation that's going on. It's an exciting technology. I think it represents a potential big step forwards. I think there's going to be a lot of individual variability in how MS centers use this blood test. And while you can take a look at the consensus paper from the Consortium of MS centers, they kind of make it sound like that this is something that every MS center is going to be doing on a regular basis. And I think we probably will get there. I think like a lot of new technologies, it's something that will probably roll out more quickly in some places than others. How often this is used could also vary somewhat depending upon what the treatment paradigm is like in a given MS center. I've heard the argument made that if I have someone on one of the more effective therapies, say a B-cell depleting therapy or a natalizumab or a cladribine, and let's say that I did the serum biomarker and it comes back elevated, suggesting that there is still some degree of active inflammation and some neuronal degeneration, what am I going to do differently if I already have the person on the most effective therapy? And I don't know that we have an answer to that. Maybe we could think about moving between highly effective therapies, maybe to something with a different mechanism of action, but I don't know that we have the final answer to that question. When you're talking to your MS care team, this is a subject that could come up. It's Neurofilament Light Chain. You'll see a little S in front of it that stands for serum. It is a blood test that is commercially available now through several different labs. I think this represents an interesting tool that's going to help us, better manage multiple sclerosis for the long run and make sure that individuals are getting as appropriate of a therapy as possible.